2, 3, 2, 1.
All right, hello, everybody. It's Dr. Alex Earl here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. And of course, it's time to get to spend with you guys and go over all sorts of plastic surgery topics. And today, I was thinking to kick it a little bit old school because it's been a while since we've kind of done one of these. As you know, last week we did our comprehensive review of the mommy makeover, and so we're going to continue in that series now. And today we're going to be doing the comprehensive review of the BBL, or the what's commonly known as the Brazilian butt lift. Okay, so we're going to get into pretty much all sorts of topics regarding the BBL. Of course, if you guys have any questions, I'll be happy to answer that. And today, if there's some good pertinent questions in the middle of the talk, we can kind of interrupt and we can answer those then. Or if not, of course, I can answer them towards the end of the talk as well. Okay? So today, let's go ahead and go into pretty much in detail about everything that encompasses the BBL. So BBL stands for Brazilian butt lift. Okay? Why is it called that? Because they say that one of the people that created it is a doctor called Dr. Ivo Pitangui, who is from Brazil. And he actually kind of came up with this procedure all the way back in the 70s, okay? Although it wasn't really popular until much more recently. And so what is a BBL? Well, it's essentially lipo 360, so lipo of the entire trunk. That means the abdomen, the sides, the flanks, the waist, and the back. And you're combining that lipo 360 with your fat transfer, which is typically to your buttock and hips, okay? It can be initially, back in the day, it was just kind of your regular old liposuction. Today, it's a lot more what we call liposculpture. So we're actually kind of sculpting the body. We're creating those curves. And you can combine that with HD lipo if you want as well, or high definition liposuction. So there are all sorts of variations of the BBL. As you know, here at Pure, we have our signature South Beach butt lift, which is a variation of the BBL with some very important differences there. And then you have your skinny BBLs or your BBL with HD lipo. These are all variations that you can add to the procedure. The other thing you can add to the procedure are additional areas. So if you want, you can add liposuction to the chin or the arms, the inner thighs are the most common add-ons that we have to your BBL. Here in the state of Florida, there is a maximum amount of fat that we can remove in that single surgery setting at one time. So what is the maximum that we can remove here in Florida is 4,000 cc's. That is the max. Okay, now this does vary from state to state. So in another state or even in another country, such as Colombia or the Dominican Republic, this may be different. But this is a rule that we have here in Florida given to us by the Florida Department of Health, and therefore it applies to all plastic surgeons or cosmetic surgeons in the state of Florida. So don't let any surgeon in Florida tell you they can do anything different when you're doing the surgery in what we call an outpatient surgery setting, all right, or an office-based surgery center, which is what we have here at Pure, which is where most of the clinics here in Florida are. If you're in the hospital, you're staying in the hospital overnight, then that limit is significantly higher in the hospital setting only. Okay, so that's what the BBL is. It's a very popular procedure nowadays because it's a very powerful procedure. Okay, it's really a way where you can truly alter the shape of the body in a way that nothing else can. You cannot really do this with diet and exercise alone. That's why I always say that the best combo is all three: surgery plus diet plus exercise, to have the most optimal results and the longest lasting results. Okay, but going to the gym is not going to fill out your hip dips. Going to the gym is not going to really alter the shape of your body. Okay, so if you have a very square or rectangular shape, a SpongeBob type of shape, you'll just go from a bigger SpongeBob to a smaller SpongeBob with diet and nutrition alone. But with a BBL, liposuction and fat transfer, you can actually take out the fat from the areas you don't want and put it into the areas you do want, and then we can truly make someone go from a SpongeBob to an hourglass figure in that signature upside down heart shape from behind. Okay, all right. So pre-op, of course, not everyone's a candidate for a BBL. Okay, we do have certain age limits and BMI limits. My max BMI is 30. Of course, it's going to vary from surgeon to surgeon and whatever their comfort level is. Okay, so my max BMI is 30. I think, if you start to go higher than 30, complication rates may start to go up, and also the results are not going to be as good. All right, so that's why I like to have my max BMI at 30. Also, age does make a difference. This is a procedure that is tough on the body. Okay, and I have found over the years and over 3,000 BBLs that I've done, okay, that once you start getting above 50 years of age, the patients don't really tolerate the procedure very well. And so when I noticed that when we're doing the older patients, they would have a higher chance of potentially ending up in the ER or in the hospital, then I set my limit. So my age limit is 50. So my max BMI is 30 and my max age limit is 50 for this procedure, okay? Before surgery, of course, we want to make sure that you're healthy, so we're going to be checking on your labs. We're going to check your EKG, make sure the heart is functioning well. We're going to ask for a medical clearance from your primary care doctor, okay? Now these three, labs, EKG, medical clearance, we're going to require that for 100% of our patients here in Pure. Every single patient has to go through this, okay? Because as you know, here at Pure Plastic Surgery, your safeties are #1 priority, and that starts with making sure that you're a good candidate. And therefore, we require this from every single patient that we have, okay? Now, there may be other things that we need depending on that particular patient. Say, for example, you have hypothyroid disease. Well, then we're going to ask for additional labs. We're going to ask for a thyroid panel, and we're going to ask for an additional clearance. We're going to ask for a clearance from your endocrinologist or endocrine doctor, okay? So that's an example there. Say, for example, you've had high blood pressure for a long time. Then we may ask for, say, a cardiac clearance. It's a possibility, right? So that's where we start to kind of specify this to each unique patient, all right? But yes, it is possible that you may need other labs or other clearances, okay? All right, what are the things we don't want you to do? So starting 30 days before surgery, absolutely no nicotine in whatever form it comes in, all right? So definitely, of course, no cigarettes, but no gum, no nicotine gum, no nicotine patch, exactly, yeah, just no form of nicotine whatsoever. Your body has to be nicotine-free on the day of surgery. We are going to test you, so we're going to do a urine test, and if that urine test comes out positive for nicotine, your case will be canceled. If that urine test comes positive for drugs, such as amphetamines or cocaine or things like that, your surgery will be canceled, okay? What are some of the ones that we do accept? We do accept the benzodiazepines, which are the ones that some people take for anxiety, such as, Ativan, okay, is an example of one of those medications. So if you have that, then you're okay. And the other one that we do accept is the THC, all right? So if you have CBD or THC alone, meaning no nicotine associated with it, just THC or CBD, then you're okay for that as well, okay? All right. And then last but not least, weight loss medications. You have to be very careful with your weight loss medications, okay? The one that used to be popular, not as popular today, but it used to be fairly popular, is one that's called phentermine. Phentermine acts very, very much like an amphetamine, okay? And that can have serious consequences when combined with general anesthesia. It could lead to basically a heart attack, okay? So, no phentermine in the system for surgery. We want you to stop phentermine at least 30 days before. And now some of the more common ones today for weight loss are the glutide. So the semi-glutide, the Mounjaro, those types of medications. These are excellent, excellent medications for weight loss, and I do highly recommend them. I think they're going to take over the weight loss industry. I think bariatric surgery is like it's on its way out. Nobody's going to need a gastric bypass anymore or a gastric sleeve. You're just going to have to do this injection or even a pill nowadays, and you're going to lose massive amounts of weight. But you do have to stop it before surgery. So starting at least ideally 3 weeks, minimum 2 weeks, but ideally 3 weeks before surgery, you will stop your semaglutide or your Mounjaro, okay? So that we can allow things to regulate, and so you can be ready for your general anesthesia. Why is that? Because these medications, they delay what's called gastric emptying, and so the stomach is full all the time. That's kind of how they work, right? It decreases your appetite, but you don't want a full stomach when you're undergoing general anesthesia. That's the reason why we ask you to stop eating and drinking 8 hours before surgery, okay? So, For that very reason, we want an empty stomach, so you have to stop your semaglutide or Mounjaro at least 2 to 3 weeks before surgery. Got it? Perfect. All right, so now you've done all this, and hey, yay, we write you that email. Everybody's so excited about you're clear for surgery, which is great. All right, now remember, we are going to test you for the drugs and nicotine and all that the day of surgery, so be careful with that. But if everything looks good, then we're okay to proceed. All right, I perform all of my BBLs here at Pure Plastic Surgery under general anesthesia. Okay, I do not do these procedures, these major procedures, I would call it a major procedure, under local. Okay, I think it's a lot of liposuction. We're working the entire body. All right, and we want our patients to be comfortable. I think trying to do it under local, the patients are uncomfortable. That makes the surgeon uncomfortable. Therefore, there's less liposuction being done, less sculpting being done. The results suffer. Okay, the patient suffers. It just, at least in my opinion, it's not a good way to do this procedure. The other thing is that if you're trying to do this procedure under local, that means you have to, of course, numb the body somehow. So you're injecting this medication that's called lidocaine into the body, and that's a tumescent fluid that we put in. Okay, so you put the lidocaine inside the fluid there, and the body can only take so much lidocaine before it becomes toxic. There is such a thing as lidocaine toxicity, and if you have too much lidocaine in the body, it can affect the heart, and it can affect the nervous system, seizures. Okay, so many reasons why I don't do it under local. I know a lot of patients ask for it. Actually, I just don't think it's the right way to go. I think your results will suffer, and actually there's an increased risk, okay, because you have that lidocaine. If you do too much lidocaine, you can lead to lidocaine toxicity. All right, so I do them all under general anesthesia, and when I do it under general anesthesia, I don't have to use lidocaine at all. So I can completely, 100% eliminate that risk, okay? All right, but what are some of the things that we add on which I think are great and that you should definitely consider for any time you're going to be doing a BBL? Well, we have 100% of our patients, we use the Cell Saver. That's a machine that separates the blood from everything else, and then we can give that blood back to you, kind of like an auto transfusion, and therefore there's less blood loss for the procedure. Remember, when we do liposuction, we're removing the fat, of course, but also along with the fat comes some liquid and some blood. All right, then we're able to separate the fat and the liquid. We're able to separate the fat from the liquid, and then we run that liquid through the Cell Saver. The Cell Saver has multiple filters, like 3 to 4 filters, and it separates the blood from everything else. And then we're able to give that blood back to you, and therefore there's overall less blood loss for the case. You're feeling better, you're feeling stronger, you're recovering faster. So all of our patients receive the Cell Saver. And then the other thing that, of course, all of our patients receive is we do this under ultrasound imaging or ultrasound guidance. This is now a law here in Florida. So every single BBL that is done in the state of Florida must be done with ultrasound guidance. Okay? This law passed this year. Well, guess what? Me and Pure, we've been ahead of the game for years. I've been talking about this since 2019. And those of you that have been following me for a long time know this to be true. Okay, that's when I first took my first ultrasound guided BBL course back in September of 2019. Since then, I've done close to 2,000 ultrasound guided BBLs, which is probably the most of any surgeon here in the US. Okay? So definitely ahead of the curve. Okay, we saw that this was the way to go. This is the way to make this procedure safe, and we've been doing it for many, many years. And we've been helping, making this part of kind of a mandate here in Florida. And now it's a law here in Florida that all BBLs have to be done under ultrasound guidance. Why is that important? Because that's what helps prevent this, which we're going to talk about in a second. But when you have the ultrasound, you're now turning a blind procedure into one where you can see. You see exactly where your cannula, which is the instrument that we use to place the fat, you see exactly where that cannula is. You make sure that it's in that safe space between the fat and the muscle, okay? What we call the subcutaneous fat layer. All right, so between the skin and the muscle, you have the subcutaneous fat layer. That's where you want to be. That's your safe space. That's where you can place the fat safely, and you don't run the risk of injuring the large vessels, which are the superior and inferior gluteal veins, okay, and causing a fat embolism, which can be deadly. All right. So that's why ultrasound is a must. And I think, now it's a law here in Florida, but I honestly think that all ultrasounds, all BBLs done anywhere in the US or the world should be done on the ultrasound guidance. And that's part of our mandate of the World Association of Gluteal Surgeons, or WAGS, of which I'm the president. So I'm the president of WAGS, and so we have our mandate is to make this procedure safe, which it can be done very, very safely. Okay, and as part of that is the use of ultrasound for the BBL. And so we don't only just talk the talk, but we walk the walk. We actually have training centers where we train surgeons how to do this. Okay, and here at Pure Plastic Surgery was the first training center where we started to teach surgeons from all over the U.S. and other countries how to use the ultrasound for guidance when doing the BBL to make this procedure very, very safe. Okay? And then lately, the new star of the show, I love this machine. All right, and I've been talking about it for the last few weeks. I call it my lightsaber, but I've been using the Vaser, and it is awesome. I highly recommend this, again, for any liposuction procedure. All right, what it does is, now different from this is ultrasound imaging. This is ultrasound energy. Two different things, okay? But the Vaser uses ultrasound energy to basically break up and emulsify the fat. It makes it easier for the fat to come out, and therefore there is less bleeding, less bruising, less inflammation, and because it does impart a little bit of heat, there's better skin retraction. And who doesn't want that? Who doesn't want better skin retraction, less bruising, less bleeding, and less inflammation? All right, so we've been using it for the past few weeks. We've had great results with that. The skin really retracts very, very, very nicely. Definitely a lot less bleeding. So it's been very helpful, and I do recommend adding this to any liposuction procedure, whether it's with fat transfer or not. I'm actually thinking about it. I'm thinking about it because I like it so much, and the results are so much better, of pretty much making it mandatory for all liposuction procedures that I do here at Pure. So that may be coming soon. Okay? All right. So yes, in surgery, we want to be using the Cell Saver, ultrasound, and the Vaser. Okay? For best outcomes. All right. So now you've had your surgery, and it's time for recovery. Okay? So I'm going to go over a few things which are super, super important, but here's the take-home message. The recovery and the post-op care is just as important as the surgery itself. Let me say that again. The recovery and the post-op care for this procedure is just as important as the surgery itself. I can have a beautiful result on the table, and if you don't do the things that you're supposed to do, it will get completely ruined. Okay? So it is just as important. All right, number one, hydration. You have to drink a gallon a day. I know it's a lot, and a lot of people don't reach that goal, but that is the goal. You gotta drink a gallon a day, lots of water, some Gatorade or something with electrolytes, okay? And a little bit of pineapple juice can help as well. So a gallon a day. The next one is your walking. Why is walking so important? Because we want to minimize the risk of blood clots, which typically start in the legs, okay? So walking at least 10 minutes every hour while awake, and when you go to sleep at night, you're only going to be able to sleep 5 hours straight before you start that walking routine once again. All right? You do these two things, it's going to keep you out of the hospital. You don't do these two things, you're going to end up in the ER. You're going to end up dehydrated or with a blood, or even worse, potentially with a blood clot. Very dangerous. All right? So you have to take care of that. All right. Next, we're going to skip on that for a sec. Your compression. All right? You have to wear a faja first 6 weeks, night and day. The next 6 weeks, 12 hours a day, but you're going to be wearing a faja in some shape or form for the first 3 to 4 months. Incredibly important, okay? You need adequate compression, but here's where people go wrong. Sometimes they try to go too tight too quick. If your faja is too tight too early on, like in the first week or two, that is actually bad. It's detrimental and can lead to increased risk of skin necrosis, lipoburns, faja burns, basically skin dying, okay? It can increase the risk of fibrosis, okay? Because it's not getting adequate blood flow to heal, all right? So you don't want to go too tight too soon. You're going to start with your stage 1 faja, and then once the skin's looking good, everything looks good, then you'll switch to your stage 2. And nowadays, I'm not even putting in your faja the first night, okay? I've learned over the years, over multiple procedures, that it's best to like stay out of the faja the first night. We're going to do an evaluation. We're going to check on your skin. We're going to make sure that everything looks good. And if everything's looking great, then you'll start your faja on post-op day number 1 after your first massage. Okay? All right. And that leads to the next thing, massage. Incredibly important. Post-lipo-lymphatic massage by a professional. Okay? You're not going to Massage Envy for this, all right? It's a totally different type of massage. You need a professional, someone with experience who really knows what they're doing, and they have experience specifically in post-lipo-lymphatic massage. You're going to need a minimum, absolute minimum, of 20 massages after this procedure. That doesn't mean, some people may get 25, some people may need 30. You have to think about that ahead of time and budget for that ahead of time. But at the very least, you're going to get at least 20 massages after this. Incredibly important. If you don't get your massages, they increase the risk of fibrosis and scar tissue, and contour irregularities and unevenness goes way up. Okay? All right, compression massage. And then here we're talking about the nutrition, so you definitely need to feed the fat. You want to increase the healthy fats in your diet. Okay, so I'm talking about avocados and eggs and red meat and salmon, okay? But sometimes it's hard to keep up the calories with that, so you need some milkshake and ice cream or some Boost, go ahead and do that too, okay? But you cannot lose any weight in the first 3 months. Actually, if you gain maybe a few pounds, anywhere from 0 to plus 5 pounds, even better, but you definitely don't want to go below baseline. That's going to cause too much fat loss, okay? So you want to be feeding the fat for the first 3 months, at least 3 months of feeding the fat, all right? You will go through that physical and emotional roller coaster, and I have a whole talk about this, and if you want to look that up, please go to our YouTube channel, Pure Plastic Surgery, and look up the physical and emotional roller coaster. But let me just say briefly that at 6 weeks, you will hit a low point. Most of our BBL patients will hit a low point at the 6-week mark. Why? Because the waist hasn't shrunk yet, you're still having some swelling, you're still feeling pretty yucky, but you've lost a lot of the volume in the buttock and hips, okay, because you've lost a lot of the swelling, some of the fat has died off. We always lose at least 30% of the fat that we transfer, and you haven't gone into the fluff phase yet. The good news is that after the 6 weeks, you will get into that fluff phase, all right, and then those fat cells that have survived will start to plump up and fluff out. The waist will continue to shrink, the skin will soften up. That all entails what the fluff fairy does for you, right? And you'll see a more final result anywhere from 3 to 6 months out. I used to say only 3 months, but after 3,000 BBLs, I just know that there's some patients that are slower than others, right? So you may not be ready at 3 months. It may take you a little bit longer. And it's not unusual to not be, completely settled at, 3 months, 4 months, 5 months, or even 6 months out. All right, so moving forward, we're not going to be really doing a final evaluation until you're at least 6 months post-surgery. Okay? All right, good. So that's recovery there in a nutshell. And we've talked about a lot of the good, right? You're looking awesome, you're looking slim, hourglass shape, upside down heart from the back. Okay, total body transformation. All right, but we got to talk about the potential downsides as well, right? So what are some of the complications that we could have? Well, the one that everybody's scared about, the one that you see on social media and regular media that they still talk about is what's called a fat embolism, right? So when they talk about the deaths that are associated with the BBL, it's because it's due to this, a fat embolism. What happens? Well, if you go too deep into the buttock, or deep to the muscles, you're in the muscle or deep to the muscle, you can injure these large vessels, which are called the superior and inferior gluteal veins. And if the fat gets into the veins, they have a direct route to your lungs. All right, that's going to cause a pulmonary fat embolism. Essentially, your lungs are clogged up. All right, you can't exchange oxygen, and the patient dies. Okay, and it's something that can happen like this. All right. The good news is that doesn't have to happen. All right, because now we don't have to do this procedure blindly. We can use the ultrasound, like I was just talking about, like I've been doing since 2019. It just makes logical sense. Now we see exactly where we're placing that fat. We make sure that we're above the muscle in that safe space, all right? And the chance of fat embolism becomes extremely low, okay? So if you go to the right surgeon, someone with experience, someone who uses ultrasound, that is extremely low risk of any fat embolism, Okay? All right. Next, of course, we talk about blood clots. These are your DVTs and your PEs, so pulmonary embolism and deep vein thrombosis. This happens typically if you're not walking enough, right? So where the walking becomes so important, okay? So walking is going to prevent the blood clots. You can't just be sitting or laying around all day. That's going to cause a problem, okay? All right. Next, bleeding. Yes, it is possible to bleed with this procedure from the liposuction part of it. So whether, lipo 360 or BBL, there's always a possibility of bleeding, okay? That's why we use a cell saver to try to minimize that risk and to give back some of the blood, okay? But it's always a possibility. And, I would say that occasionally, maybe once or twice a year, I will have a patient that will require a blood transfusion after the procedure, all right? Even with the cell saver, even with everything that we do. What I haven't found out yet, because we've just started doing it, is the vaser. And I'm thinking now that we're using the vaser more often, that's going to probably decrease that incidence even lower, which is great, okay? But bleeding is always a possibility. One thing that should not happen, but unfortunately we've seen happen, and actually there was one here in Florida, unfortunately not too long ago, is what's called perforation, okay? When someone's doing the liposuction and they go too deep and they perforate the organs inside the abdomen, okay? That comes from an inexperienced surgeon, okay? Or someone that's having liposuction with a hernia, okay? And perhaps they didn't know they had a hernia, or perhaps they knew and they did it anyway. But if you have a hernia, you should get that hernia fixed before you do liposuction, all right? And this is definitely something that's preventable, all right? You shouldn't be doing lipo on anyone with any large hernias. And of course, the surgeon needs to have good technique, all right? Okay. Infection, always a possibility, so we want to do everything we can to minimize that risk. I can tell you that here at Pure Plastic Surgery, we do many things to minimize that risk, and we have an extremely low infection rate for this procedure. Our infection rate is about 1% to 2%, where the national average is about 10%. All right, you can never bring an infection rate down to 0. The only way to have a 0% complication rate is to not do surgery at all. But fortunately, due to all the maneuvers that we do, we're able to get this risk quite low. All right, the next one is fibrosis. Fibrosis typically happens if you're not compressing well and if you're not doing your massage as well. Okay, there are some genetic factors too. There are some people that are just more prone to fibrosis. It's typically the same people that are more prone to keloids because it has to do with scarring. Okay, so there are some genetic factors, but they can, for the most part, can be prevented with adequate compression, adequate massage. All right. The next one is, well, we talked about dehydration, right? You got to drink that gallon a day, and so the most common cause to go to the ER after this procedure is dehydration. People are not drinking enough fluid. That is the #1 cause. And a lot of times you just go to the ER, everything's fine. They give them a liter or 2 liters of IV fluids, and they go home. Right? Try to avoid that, right? You have to do your hydration. You have to drink a gallon a day, okay? All right, and then this one, skin laxity, all right? If you're coming into this procedure with poor quality skin, you've had maybe some pregnancies, you have some weight loss, all right? Or just genetically poor quality skin, you have skin that is loose, that it wiggles around, a fluffy belly, or, you have like the striations, right? The stretch marks. All those things are indicators of poor quality skin, which means that after the liposuction, that skin may not retract well. And if the skin doesn't retract well, it will look uneven, all right? Because some areas of skin retract better than others. So you have one part that retracted, one part that didn't, okay? And so you're gonna look lumpy, bumpy, wavy, uneven, okay? And it's not because of uneven lipo. It's because you had poor quality skin that did not retract well, and therefore it looks uneven. All right? Repeat after me. It is not due to uneven lipo. It is due to skin laxity, loose skin. Why is that so important to know the cause? Because then that determines the solution. Okay? If you have skin laxity that's causing your uneven looking belly, then you need to get a tummy tuck or a skin tightening procedure to fix that problem. Further lipo is not going to fix the problem, it's only going to make it worse. But it's a common confusion. A lot of people look at that and they say, oh, it was uneven lipo. Let me go get more lipo. And guess what? The problem didn't get better and it maybe got worse. All right, because it was the wrong diagnosis to begin with. Okay? The most common reason for unevenness, especially in the abdomen, especially in that lower abdomen, is because of poor skin quality, loose skin. Okay? That's why when someone comes like this, I always say do your tummy tuck first. Do your tummy tuck first, get rid of the loose skin, do your muscle repair, and then come back for your Lipo 316 BBL. Alright? Woo! That was a lot.
Huh?
Okay. So I think that was pretty comprehensive. Like if you ever want to know just about anything about BBL, I think we covered it. But of course, I'm happy to answer any questions.
Okay, let's go. First on YouTube.
YouTube, alright.
Yes, sir. Well, this is the message. I just got a BBL a week ago, and
Okay.
it looks lumpy.
Okay. So, and I'm not sure if you're talking about the belly or the buttock, but it's what I can tell you this: don't worry too much. All right. It's only been a week, so they're gonna have inflammation, you're gonna have bruising, all of this swelling going on. So there's a lot of things that need to settle in. Okay. So what I would say is, listen to your surgeon, of course, but you're gonna have to get into your compressions, your faja, and your massages. All right, and that's what's gonna help smooth everything out. So make sure you stay hydrated, make sure you're doing your walking, use your adequate compression, don't compress too much too early, you're only a week out, okay? And make sure you're getting those daily massages.
Do you suggest sitting on the plane after a BBL?
Right, so even though it's not ideal, it's something that's it's a necessity, right? Something you're gonna have to do. So a lot of our patients come from out of town, and so they're gonna be with us here up until post-op day number 5. But after that, they're able to fly back home. And yes, you're gonna have to sit down on the plane at the very least for takeoff and landing, perhaps for some other time, especially if there's turbulence or other issues. So you need to have your BBL pillow with you, and you're gonna use that BBL pillow for takeoff and landing and throughout the flight.
At TikTok, can you do BBL and tummy tuck together?
So I do not recommend that. Okay, there are surgeons out there that do it. They're in other states, even some here in Florida. I'm not sure how they do that because of the limits that we have, and of course in other countries like Colombia or the Dominican Republic. Okay, my recommendation is to separate those procedures, and I always recommend you do your tummy tuck first, and then come back 3 to 4 months later to get your lipo BBL. Why? Number one, I think you're going to get the absolute best result when you do that. You're going to get the best result from your tummy tuck, and you're going to get the best result from your BBL. Number two, this is specific to Florida, but here in Florida, when you do a tummy tuck, you're limited to removing only 1,000 cc's of fat via liposuction, which is not a lot. It's typically not enough to really give you a full BBL. It's really not enough to really take care of all the fat in the entire trunk area. Okay. So you're not going to get the best results, right? You're not going to get that bang for your buck. And then number three, of course, recovery is going to be in a way that's going to hinder your results, right? Because you can't be on your belly after a tummy tuck, all right? All that needs to heal, and typically, at least the way I do my tummy tucks, are very, very tight, so you can't be laying on your belly because you're kind of inclined like this. In fact, you're not even laying flat on your back. You have to be with your back propped up, like in a recliner with a few pillows there, because of how tight I like to make my tummy tucks. Okay, but then of course that means that you're going to be on your buttock and hips. So now you're compromising your BBL, right? Because you're putting pressure on those areas, so more fat can die or can lead to fat necrosis. All right. So for all those reasons, I don't recommend combining them. And last but certainly not least, your complication rates go way up. The chances of bleeding and needing blood transfusions is a lot higher when you combine those two procedures. The chance of the skin in the tummy tuck area not doing well, dying, skin necrosis is also higher. Okay, chance of blood clots and pulmonary embolisms is higher. Okay, so it's not worth it. It's not worth it.
Muchos pacientes en español.
Okay,
Que si podemos entonces hacer un live next week solo en español para que hagan todas las preguntas.
Seguro. Aquí podemos hacer los lives en español. No sé si entendieron lo que hablamos hoy.
No, por eso lo quieren
si
completo.
No, entonces lo podemos repetir en español y contestar las preguntas.
So, miércoles que viene en español.
Sí.
Miércoles que viene en español. Ok. Seguimos entonces. Do you offer Tummy Tuck 360?
So pretty much for the, you mean a circumferential tuck, I guess? Like a tummy tuck with a body lift. Yeah, we offer that here at Pure. Actually, the one who's really, the top-notch expert in that is Dr. BBL. But she can definitely do the circumferential lift, okay? And I believe that's what you're asking. If you're asking about tummy tuck with lipo 360, then no, for the same reasons that I just talked about with the BBL.
How many places of lipo you take out with a 360 lipo?
So, some people call it areas. I mean, I don't know, and they'll say like 12 areas, which is fine, but really it's the entire trunk, okay? So that means your entire belly, so the entire front belly, the entire flanks, okay, so the entire sides and the waist, and pretty much the entire back except for this area all the way up here, which we call the buffalo hump, okay? Most people don't have a buffalo hump, so they don't need it. If you do have a buffalo hump, then we can put it on as an add-on, okay? But it's pretty much like 90% of your back. So, all right, pretty much the entire trunk is what's included in the Lipo 360.
What can you tell us about body type?
All right, so body type is something that you can add on, and it's used to help with skin retraction, okay? Now, is it for severe cases? No. If you have quite a bit of skin, of loose skin or skin laxity because of multiple pregnancies or weight loss, body type's not going to do it for you. All right, it's for those patients that have more like a mild to maybe moderate amount of loose skin. Therefore, then we can add the body type to help that skin retract better. It works by using something called RF or radio frequency energy, okay? And that helps impart a heat and an inflammatory response underneath the skin, which then allows that skin to retract. It can take up to 6 months, okay? Keep that in mind. It can take up to 6 months before you see the full effect of the body type, okay? Body type is very, very similar to something that people also call J-plasma, all right? They both use RF energy. They're just two different machines, but they're used for the same indication and they use the same type of energy.
Okay. When those Valentinas unfiltered
Yeah?
result come out?
Okay, well, it should be soon. I mean, I'm sure you've been following her along. She's doing great. She's doing awesome. We saw her here today, and everything looks wonderful. So yeah, stay tuned.
What complications we can have after 50 years old? Why do you don't recommend it?
Yeah, so everything depends on the surgery, right? If you're doing just a breast surgery, then over 50 is fine. Certainly if you're doing like your eyelids or your face, those are for patients that are older as well. But for this procedure in particular, so Lipo 360 with fat transfer, it's a procedure that takes a toll on the body, okay? It's a big procedure. The recovery is very, very tough. And I found that in my experience over the past 5 years and 3,000 BBLs, that patients over 50, too many of them were just not tolerating the procedure well. Okay, they were feeling extremely weak after surgery, and they ended up in the ER with the need of either hydration or blood transfusions. Okay, and so that's why I decided to, of course, like we said, safety is our #1 priority. I don't want our patients to end up in the ER in the hospital setting, and so I decided that my cutoff for this procedure is 50 in order to try to minimize any of those complications or risks.
Last question, Doc.
All
Can
right.
Vaser help with fibrosis?
Yes, that is actually a very good question. So that is a good question, and I didn't mention it, but yeah, if you develop fibrosis early, you got to continue with the non-surgical treatments. Okay, you gotta continue your massage, but you can add wood therapy, you can add other things such as cavitation, carboxytherapy, and other things that can help with your fibrosis. Okay, but say it's been a year. It's been a year, you still have some areas of fibrosis, they didn't get better. Well, at that point in time, the non-invasive stuff is not really going to work. So you need something more powerful. And for that, we recommend the Vaser. So the Vaser is great because it can actually break up and loosen up those areas of fibrosis, okay, which then can allow you to then smooth things out and try to get rid of that fibrosis at that time. All right? Okay, all right, everybody. Well, I hope you enjoyed this. This was quite a comprehensive review. I pretty much answered any questions regarding BBL that you could have. And of course, we'll look forward to seeing everyone next week. I guess we'll see our Valentina fans. Okay, así que la semana que viene, bueno, lo vamos a hacer en español. Así que va a ser mismo día, misma hora. Ok, lo hacemos en español y contesto todas las preguntas en español también. Okay, all right, everybody. Take care. Ciao.
Okay.